When we're faced with the situation when Sheila brings concerns to her physician that she may have a sexually transmitted illness that her husband doesn't know about, there are several points we need to consider. One is confidentiality for this patient is extremely important and must be upheld. We do need to teach Sheila about the consequences of her decision in not talking with her husband beyond her relationship impact. That if she has a disease that may be passed on to her husband, we need to urge her for partner notification, as we would for any patient for partner notification with sexually transmitted illnesses. As physicians, we do promise to uphold confidentiality broken only by great risk or threat to life to another person. So depending on which illnesses we're talking about, we could then discuss those risks with Sheila further. For example, if Sheila had chlamydia, that's easily treatable with an antibiotic, and her husband would have symptoms, but it's unlikely it would become a systemic and or lifelong disease. In contrast, if she had gonorrhea, which can become an invasive systemic disease for her husband, that would have consequences, or if he were to acquire HIV from her, from this encounter with another person, we would need to discuss those risks, because HIV now is a lifelong treatable disease that wouldn't affect his mortality if treated appropriately. So those are examples of there's a spectrum to the illness and to the limits of confidentiality. And above all, we would not want harm to come from another person from maintaining confidentiality.